everyone. Welcome back to another episode of Future of Nursing podcast, brought to you by Focusing on Young Nurses Initiative, FYNI. And today I have with me a very good friend, and he's a medical doctor. His name is Dr. Michael Alimi. He's going to introduce himself soon, and it's going to be a very interesting session today as we invite him to talk about the relationship between medical doctors and nurses in hospitals. We're comparing both Nigeria and the diaspora generally anyway. So I'm going to allow him to introduce himself now.
Okay, thank you, Ruth, for the introduction. My name is Michael. I'm a medical doctor. I'm in GP specialty training in the UK, practicing in Nigeria for a couple of years before moving to the UK. This is my second year of practice in the United Kingdom.
Right. Thank you so much for joining us today. There's something special about Michael, and that's part of why I decided to come to the podcast. And what is so interesting is the fact that he's a medical doctor, but not by association. Your mom is late, but I'm aware that she was a nurse when she was alive. Your elder sister is also a nurse, and you are married to a nurse. Most of your friends here in the UK are nurses, if not all, right? So I'm his friend. I'm his very good friend, and I'm a nurse too. This is part of why we've been here to talk about the doctor-nurse relationship. We have an idea of what it's been like for you having nurses around you. So the first question I would like to ask you, what was your opinion about nursing in general before you went into the medical?
That's an interesting question. In 2005 or 2006, I had this interesting conversation with my mom. I said that I was like, I wanted to be a nurse. And she laughed and she was like, why do I want to be a nurse? I said, I see what you do. When she goes to work and she comes back, she gives us a day, and then she talks about the things she's done, how she's helped students, supported doctors. She worked in the health center at that time. So I found it fascinating. I was like, I think I want to be a nurse as well. So she said that that's a good choice, but you're still young. You have the world laid out in front of you. In as much as you can go in and do nursing, you can go in and do anything you want to do as well. She told me, take your time, see what you like. There are so many options available for you. She talked about pharmacy, she talked about medicine, which is interesting because I was telling myself that if anything doesn't work, I was going to do nuclear physics. So I had this kind of love and respect for nursing, what I learned from my mom, from people who surrounded me at the time. Quite interesting being able to understand what they do and why they do it so important to the healthcare. And it's just fascinating. That's the word I can say.
Wow, that's interesting. I never knew you ever thought of being a nurse. This is the first time I'm hearing that.
Yeah.
Right. So I remember we met in this jam lesson back in 2011, and then I wanted to be a medical doctor as well. We're writing jam. By the way, viewers, this guy is very hot though. I think he got like 300 or something in jam then now. And we went to check our score together. And, I had like 260 something, and everybody was just focused on him, and they were celebrating him in the. Anyway, those are old memories, but yeah, it's interesting. Right. So, as you were talking, the question that came to mind was when your sister talked about her practice, and then your mom as well, when they talked about, did they at any point in time share some negative experiences they had with medical doctors? That was before you went to medical school anyway. I just want to have a view of what your idea was about us before you went to school. So did they share those experiences, and what was your reaction like in such situation?
Yes, like I mentioned earlier, almost every day, well, if not every day, after work, my mom would give us the gist of what happened at work. So there are instances where there'll be like quarrels between nurses and the doctors about probably something to do for the patients, or because of some mismatch when it comes to communications, and then because of this power tussle between doctors and nurses for a long time in the country. So there has always been instances like that where there will be conflicts, and it's interesting because when it comes as a gist, it's interesting because you're like, really, tell me more, happened exactly. But of course, it's not funny. It's not funny having that to happen in the place of work. It's the tea of the day, and we just have the tea. Yes, there have been several instances like that. Instances of when one party is disrespectful of the other, or when one party treats the other party in a unprofessional manner, when one person thinks he or she is the boss, and then others have to need to sheep. So that, of course, that causes conflict in the place of work because we are all humans, we are all professionals. Regardless what it is we are doing, we something to offer, something to bring to the table, and as a team, we should be able to collaborate and work together to have optimal care. That's why we are there for the patient. We're not there because because what we are, I mean, if there are no patients, there'll be no reason to have doctors or nurses or physiotherapists or pharmacists or therapists or whatever it is that you are.
So when you got to school and then you start experiencing this, bit of strife between both professionals, was it like a gist to you at that time, or what did you have about it? Did your opinion change compared to the experiences your mom had when she came back from work those days?
Well, at that point, it was no longer just. At that
Like
point, it was warfare. At that point, because you're in the thick of the battle, so
exactly.
you get to experience everything that people have talked about in the past. When I was in med school, there are a lot of instances and experiences where medical students have been rude to people working on the ward. There was a particular instance where someone referred to everybody else as allied medical professionals and not actual professionals, and that was World War II on the camp at that point.
Right. So, okay. Is there any experience you had personally with a nurse? Like, was there any challenging situation you had, and how did you manage it?
There was one particular scenario where I think it was my final year, and I and two other friends we went to the ward, and then one of the doctors asked us to put in a cannula for a patient, and my other friend Chike put in the cannula, and he left the sharps by the patient bedside. Of course, you know what is going to happen next.
That gets to nurses a lot, a lot. Like as a nursing student, even I mean, it pisses off a lot. Like, don't really do that. You
you,
are
you,
putting
you,
us at risk as well.
at risk,
Yeah,
so you
yeah.
know what's going to happen. There was an
Hmm.
explosion right there on the
Oh, it
road.
did
Yeah,
happen. Wow.
yeah. Generally, I try to be in the matron's good books. I don't want problems, and I just try and be on my best behavior while I'm on the ward. Yeah, so that's as a student. That's one thing I remember. As a doctor, where
Yeah,
am I going to start from?
there's a lot of
I
experiences.
mean, there's so many experiences. I mean,
Wow.
there are times when you want to dress a patient and you need a dressing pack. Yeah, I told you to dressing pack, but
Mm.
you're sure there's dressing pack. So and so yeah, you have the options. Either you romance the person's ego, or you flat out turn into control confrontation. I prefer to
Yeah.
romance the person's ego, make compliments. I make sure you're looking very nice today. You're looking very
And
well.
I know you know how to do that very well. You always sweet mouth.
Are you using a new cream? Like the way you are shining. That's you get into the world. That's
Yeah.
how to start your day, because once you start your day well, the rest of the day would not well. So when you ask for things, when you ask for this, that you are able to get it. And but if you come to the world and you're like this, and they
Definitely.
will show you
That's
say,
when
oh, you will go to the sterilizing unit to go and so yes, so you want to get something done, or you need a piece of instrument, you need to be you need to apply tact really. You can't just come off brash and say,
mm,
oh, I want this, can you get me this now. You can't talk to anybody. I mean, anywhere in the world you can't talk to anybody like that.
mhm,
Nobody is below the other.
yeah.
It's just how flow of work is supposed to be, how communication between team members is supposed to be. There have been cases where there'll be conflict, no matter how well you try to
Mm,
handle things. There'll be conflict where someone would misunderstand the other, or where one party would be flat out respectful, or where both parties might even mean well, but because one person was not listening properly, or because one person is having a bad day, or because of whatever issues, it degenerates into something else. So there are cases like that. There's one particular case when I was working, and then the patient that had a broken needle in the hand, and I wanted to remove that. I needed to go to the theater, and I asked someone to prepare the theater, and it turned into what they call basketball.
are
But
you
at the end
serious?
of the day, we all settled down. And
Wow.
one thing that we fail to understand is the nature of what we do. Both nurses and doctors is stressful to body, mind, puts a lot of burden on us. We need that that good
Yeah.
working environment to be able to manage some of these stressors and emotions. If there is already tension in the place of work, and there's tension between the two different professionals working that environment, it makes it a bit harder, because I am stressed, you are stressed, and with
Mm,
there's tension in the air already, so we're not going to get along very well. But when there's a bit of friendliness, when there's a bit of good vibes in the world, for instance, you find out that things flow better. I mean, you guys find a way to make the work bearable. One person is not shouting down or bearing down the neck of the other person, and it's just a lot much better. It's
yeah.
one place I worked in Nigeria where I had that environment. It's it shows the nurse-doctor relationship in Nigeria can actually be something much better than it is right now.
Mm,
It shows that if
yeah.
we are able to set aside our difference, each person should face well the work that they have to do, and respect each other and communicate properly. We can actually have a better relationship between ourselves. Because, I mean, most of the times you're going to be seeing nurses, most of the times you're going to be seeing doctors. You're going to have less time going outside to see other people to read with lawyers or whatever than
Mm,
people that you're going to be seeing almost every day of your life. So the best you can do to yourself is just make it a bit easier to relate with those people.
right. Okay. Let's go into the diaspora now. What would you say about your a doctor nurse relationship here in the UK, for example? Have you ever had like a similar situation where there's a disagreement or something, with the staff, a nurse, and how did you manage it? And how do you think it differs from that of Nigeria?
I would say even in the UK, there's a bit of tussle between both factions, but the difference is that here they lay emphasis on mutual respect, on teamwork, on communication.
Mm,
It is as unforgivable if you outrightly disrespect every member of the team. Okay, and they also know that there will always be conflicts in the place of work, and then they try and teach you on how to handle conflicts at the place of work. And I think that's important. That's an important lesson for us to learn. When you go to somewhere, you're working in a place for the first time, they teach you the moral that is expected for people working in the trust, and then they tell you, okay, this is what we expect from you, this is what we expect you to know. And even from the professional exams you would have taken, that you have to respect other members of the team, you're taught to learn how to work with them, to communicate with them. So that difference is glaring there. You, for example, when I go to the emergency department, I have to see a patient. You walk in and you're saying I to everybody, and everybody's just responding I back, and everybody's all smiles. And that's one thing that is very, very common in smiling.
yeah,
You're
even
working
if
on
this
your
might
own,
reach or no reach.
all smile for you. You have no choice but to smile back. So I mean,
Yeah.
when you to work and everybody's smiling at you, you can't smile on your face now. Come on, you
Mm-hmm.
can't be legit. You also smile back, and then you need
Mm,
something, and you're like, oh hi Trisha, hi Steven, like, can I get this for this patient? And the person is like, sure. What do you need? And then the person gets it
mm,
for you. And this person is also a professional, and I need to treat them with utmost respect. If someone has a concern about the patient, escalate the concern to you, and you take it up from there. Even if you can't deal with that concern that time, you tell the person, okay, I understand this is time, but I think it's not urgent enough compared to what I'm working
mm,
on right now. Give me some time, let me finish up with this, then I'll address the concern. So that's that communication, the core values that you learn on getting into the UK, it goes a long way. And I think it's a factor of the people that you work with and factor of the people that can surround you as well. Because it's the same nurses and doctors working in Nigeria that you take and bring to the UK, and
yeah.
the way we relate is different, very
Yeah.
different compared
Definitely.
to
Yeah.
how we used to be in Nigeria. So that tells you that it's just how the environment is. If we create an enabling environment, things will be better.
Mm,
Um, that being said, there have been instances where you want and it doesn't get done, or someone
mm,
is disrespectful to you. That happens. I mean, we are human. There's no way we would not have
yeah.
conflict or disagreements or things like that happening between ourselves. It's just how we are wired. But when you've been trained on how to handle conflicts, when you are quick. When someone something you do not like, you're supposed to go back to the person and let them understand that.
Yeah.
I don't know whether you meant to. I don't know whether you realized, but I was not happy with what you said.